Basal ganglia. The basal nuclei is made up of 5 pairs of nuclei located deep inside the brain hemispheres. The basal ganglia are nuclei that generally play a role in the coordination of motor movements. The structures generally included in the basal ganglia are the caudate, putamen, and globus pallidus in the cerebrum, the substantia nigra in the midbrain, and the subthalamic nucleus in the diencephalon. Caudate nucleus and the putamen are collectively called neostriatum, and their functions are closely related. The most rostral aspect of the neostriatum, where the caudate nucleus and the putamen join together, is termed nucleus accumbens. Caudate nucleus, putamen, and globus pallidus are called corpus striatum together. Putamen and globus pallidus are called lentiform nucleus. Caudate nucleus and lentiform nucleus that make up the corpus striatum are located lateral to the thalamus. Caudate nucleus resembles a comma. It has 3 parts: head, body, and tail. The front of the head continues with the putamen. The groove between the body of caudate nucleus and thalamus is called terminal sulcus. During development, the caudate nucleus is separated from the putamen by descending white matter fibers, which at this level are known as internal capsule. The lentiform nucleus is comprised of globus pallidus and the putamen. Although anatomically related, they share no functional relationship. The putamen, whose outer face is slightly convex, is located between the external capsule and the globus pallidus. Globus pallidus is separated from the putamen via myelinated axons called external medullary lamina, and globus pallidus is divided into 2 segments as internal medullary lamina, internal globus pallidus, and external globus pallidus. Substantia nigra, which is darker than the surrounding structures due to the melanin pigment in the neurons inside, is divided into 2 parts as pars compacta and pars reticularis. Subthalamic nucleus is located in the dorsolateral of the upper end of the substantia nigra and medial of the internal capsule. Efferents starting from subthalamic nucleus go to both segments of globus pallidus and substantia nigra. There are 2 connections between cerebral cortex and basal ganglia. One is direct connection and the other is indirect connection. While the direct one of these connections increases the activity of the cortex, the indirect decreases the activity of the cortex. The spontaneous activity of neurons in the globus pallidus internus and pars reticula of substantia nigra inhibits impulse flow from the thalamus to the cerebral cortex. Direct connection. Impulses from the cerebral cortex to neostriatum increase the activity of inhibitory neurons located in the neostriatum, which send efferent fiber to the globus pallidus interna and pars reticula of the substantia nigra. As a result, inhibitory neurons that transmit efferent fibers from the globus pallidus interna and pars reticularis of the substantia nigra to the thalamus are inhibited. Thus, the inhibitory effects of globus pallidus and substantia nigra on thalamus is eliminated and impulse flow from thalamus to cortex increases. This causes an increase in cortex activity. Indirect connection. The impulses coming from the cerebral cortex to the neostratum activate the inhibitory neurons that transmit efferent fiber to the globus pallidus externa. Thus, inhibitory fibers which go to subthalamic nucleus from globus pallidus externa are inhibited. Activator neurons in the subthalamic nucleus send efferent fibers to the globus pallidus interna and pars reticula of the substantia nigra. Normally, neurons in the subthalamic nucleus are inhibited due to spontaneous activities of inhibitory neurons in globus pallidus externa. However, when the inhibitory neurons in the globus pallidus externa are inhibited, the activator neurons in the subthalamic nucleus begin to impulse to the globus pallidus interna and pars reticularis of the substantia nigra. As a result, inhibitory neurons in the globus pallidus and substantia nigra are activated. This causes inhibition in thalamus and thus a decrease in cortex activity. Do not forget to like the video and subscribe to our YouTube channel.